My brand names are Premier Pro RX Protamine Sulfate and Protamine Sulfate Novaclass. My chemical name is a bit long, so you can just read it for me. For my drug classification, therapeutically, I am a heparin antagonist. Pharmacologically, I am an antidote. I am classified as FDA Pregnancy Risk Category C. It is not known if I can cause fatal harm when administered to a pregnant woman. I am administered as an antidote to heparin. I am a fairly strong basic protein that subsequently binds with strongly acidic heparin to produce a stable and inactive complex, a salt. The inactive complex between me and heparin neutralizes the anticoagulant effect of both solitary protamine and heparin. In this way, I am used as an effective antidote to reverse the activity of heparin, and is useful for treating hemorrhage as a result of severe heparin or low molecular weight heparin overdosage. Moreover, I am also frequently used in same manner to neutralize the effect of heparin given before surgery and during extracorporeal circulation procedure like those performed in hemodialysis or cardiac surgery. Now, let's talk about my pharmacokinetics. I can be administered via intravenous infusion. The onset of my action is 30 to 60 sets, with neutralization of heparin evident within 5 minutes. The duration of my action can persist up to 2 hours, depending on body temperature. The fate of heparin protein complex is unknown, but it appears to be partially degraded with the release of heparin.
I am indicated in the treatment for heparin overdosage. I am contraindicated in patients hypersensitive to the drug. Now let's talk about my side and adverse effects. In respiratory, I can cause dyspnea. In cardiovascular, I can cause bradycardia, hypertension, and hypotension. In gastrointestinal, I can cause nausea and vomiting. In dermatologic, I can cause flushing and warmth. In hematologic, I can cause bleeding. And in musculoskeletal, I can cause back pain. In nursing responsibilities, the nurse must check for possible fish allergy. Dosage is based on blood coagulation studies as well as in route of administration of heparin and time elapsed since heparin was administered. Do not mix protamine with any other drug. Slow IV administration over 1 to 3 minutes because it decreases adverse effects. Do not use protamine if only minor bleeding occurs during heparin therapy because withdrawal of heparin will usually correct minor bleeding within a few hours. Monitor BP and pulse, or more often if indicated. Continue for at least 2 to 3 hours after each dose, or longer as dictated by patient's condition. Be prepared to treat patients for shock as well as hemorrhage. For lab test, monitor effects of protamine in neutralizing heparin by the APTT or ACT values. Coagulation tests are usually performed 5 to 15 minutes after administration of protamine, and again 2 to 8 hours if desirable. Observe patients undergoing extracorporeal dialysis or patients who have had cardiac surgery carefully for bleeding. Even with apparent adequate neutralization of heparin by protamine, bleeding may occur 30 minutes to 18 hours after surgery.
For another anticoagulant adjunctive therapy, we have vitamin K. For brand names, it is Mifeton, Aquamifeton, and for the chemical name, for drug classification, its therapeutic is anticoagulant. For pregnancy category, it is C. In normal animal and human, phytonadione is virtually devoid of activity. However, in animals and humans deficient in vitamin K, the pharmacologic action of vitamin K is related to its normal physiological function, that is, to promote the hepatic biosynthesis of vitamin K-dependent clotting factor. Vitamin K is a blood clotting vitamin. The mechanism of action of vitamin K is discussed in terms of new carbanion model that mimics the proton obstruction from the gamma position of protein bound glutamate. This is an essential step leading to carboxylation and activation of the blood clotting proteins. The model comprises an oxygenation that is coupled to carbon-to-carbon bond formation, as is the oxygenation of the vitamin K hydroquinone to vitamin K oxide. The model hypothesis is also supported by the mechanism of inhibition of the carboxylase by HCN, which acts as an acid-base inhibitor rather than a metal-complexing inhibitor. The new model postulates dioxetane intermediate that explains the presence of a second atom of 18 oxygen from incorporated into vitamin K oxide in the course of enzymic carboxylation. Finally, the chemistry developed here has been used to define the active site of vitamin K hydroquinone as the carbon-to-carbon bond adjacent to the methyl group. For absorption, phytonadione is readily absorbed following intramuscular administration. For distribution, after absorption, phytonadione is initially concentrated in the liver, but the concentration declines rapidly. Very little vitamin K accumulates in the tissue. Little is known about the metabolic fate of vitamin K for elimination, and there is almost no unmetabolized vitamin K appears in bile or urine. Indications: vitamin K1 injection is indicated in the following coagulation disorder, which are due to faulty formation of factors 2, 7, 9, and 10 when caused by vitamin K deficiency or interference with the vitamin K activity. Vitamin K1 injection is indicated in prophylaxis and therapy of hemorrhagic disease of the newborn, hypothrombemia due to antibacterial therapy, hypoprothrombemia secondary to factors limiting absorption or synthesis of vitamin K. Examples: obstructive jaundice, biliary fistula, sprue, ulcerative colitis, celiac disease, intestinal resection, cystic fibrosis of the pancreas, and regional enteritis. Other drug-induced hypoprothrombemia, where it is definitely shown that the result is due to interference with vitamin K metabolism. For example, salicylate. For contraindication, it is contraindicated to hypersensitivity reaction, risk of serious adverse effects in infants due to benzyl alcohol preservatives. Also for cutaneous reaction. For side effects and adverse effects, it is for hypersensitivity reactions and cutaneous reactions. In nursing responsibility, the nurse must document the giving of the medication to newborn to prevent an accidental doubling of the dose. Observe for bleeding. Usually occurs on second or third day. Bleeding may be seen as generalized ecchymosis of bleeding from umbilical cord, circumcision site, nose, or gastrointestinal tract. Observe for jaundice and kernicterus, especially in preterm infants. Observe for signs of local inflammation. Apply pressure to the injection site to prevent further bleeding.